Hi and hello everyone. Welcome to the Nursing Virus YouTube channel. This is me Logunathan. This video regarding the AIIMS NORCET 2020, the examination questions based on the memory, which is held on the 8th September 2020 in the morning shift. Already I have discussed 70 questions under the part 1 and part 2. The furthermore 30 question I am going to discuss in the part 3. If you are appeared on the morning shift and if you remember any other further question, you can write it in the comments box or you can inbox to my WhatsApp number. Here we'll go with the today discussion. The question number 71. The vitamin C deficiency causes which disorder? The answer is scurvy. And 72. The second stage of labor start from? The answer is when the cervix is completely dilated, that is around 10 centimeter of length. And question number 73. The adverse effect of clozapine they have asked. So the clozapine belongs to the antipsychotic medication. So the answer on this following three symptom, the three list of adverse effect, any one symptom they may ask as an option. That is under the central nervous system reaction, the sedation, dizziness, vertigo, headache and tremors are very common. And when you're coming for the cardiovascular reaction, tachycardia, hypotension and syncope. And autonomous nervous system reaction, hypersalivation and weight gain and drooling of saliva and sweating. So these are the common problems when you're administering for the clozapine for that psychotic patients. So the next question. So this question also belongs to the psychiatric, that is the ECT patient preparation. So what is the role of the nurse? And they asked except. The options are wash the oil from hair and administer anticonvulsant drug and pre-medication with anticholinergic and maintain the patient for nil per oral. So the correct answer is administer anticonvulsant drug. Actually, we won't administer anticonvulsant drug even just before the night of the ECT procedure day. Because if you are administering the anticonvulsant agent, the patient will not appear the correct seizure movement during the period of electroconvulsive therapy. Question number 75. What is VVM? They ask the abbreviation, that is vaccine vial monitors are used to warn healthcare workers if a vaccine was damaged by heat. The monitor is made up of heat sensitive material that is light in color but darkens when exposed to the heat over the time, which indicate the vaccine is no longer effective. So the next question, image based. So they asked to identify the given image. So the name of the image is linear stabler, or even it is called as linear cutter. And 77. Which electrolyte initiate the depolarization process in a cardiac cycle? The answer is sodium ion channels. And 78. Find the next number 10, 9, 7, 4 and the given dash. The correct answer is 0. And the next question 79. The lithium salt clinically used in which form? So a common form is lithium carbonate, which is commonly used for bipolar disorder, especially in case of mania. And the 80th question, how much additional calories needed for the lactation mother? So the lactation mother need around 500 kilocalories per day. In case of pregnancy, 300 kilocalories per day. And 81, what is the color of tube in hospital for the nitrous oxide? So the color code maintained for that nitrous oxide is blue color. Question number 82. Identify the type of assessment shown in the given picture. They given that assessment of lateral grip of the baby. And the next question. Which state boundaries does not touch the Madhya Pradesh state? Uttar Pradesh, Maharashtra, Odisha, Rajasthan. So the correct answer is Odisha. So the next question, which syndrome occurs in chloramphenicol? So the answer is gray baby syndrome. And 85, How to maintain the patency of AV fistula? The answer is by assessing the proper circulation of the patient by the nurse. In the 86, the positive lorasiform challenge test validate the diagnosis of which condition? The answer is catatonia. And 87, which glands secrete the oxytocin? So the oxytocin is a hormone produced by the hypothalamus and secreted by the pituitary gland. And the next question related to the psychiatric. For which condition the disulfiram drug is prescribed? So mainly for the alcoholism patient. And the next question. So identify the use of marked part in the given picture. So they given that anesthesia mission and they given the anesthesia mission and they asked the peculiar part in the anesthesia mission. So that is called as inhalation liquid action. So that is that the action of the particular marked part in the anesthesia mission. And the next one, the client coming to the ER with that humerus bone fracture, what kind of assessment is expected by you to perform? The answer is the assessing the sign of compartment syndrome. And 91, the digoxin toxicity can cause, the answer is hyperkalemia. And the next question, so what is the emergency management for the hyperkalemia? They were asked. So the answer may be intravenous calcium gluconate or insulin administration with glucose is an first emergency management for case of all hyperkalemia patients. And the 93, image based question, so the catheterization without retraction of glands of penis, they given the image and they asked the answer. And 94, the anaphylactic reaction management except they given the 4 options related to the anaphylactic reaction management and they asked which is not suit the anaphylactic reaction management. And the next question, what is the clinical manifestation of septic shock? They were asked. The answer is either fever, tachycardia, diaphoresis and tachypnea. Among this, one option they may asked during the exam time. And the 96, what is the difference between dementia type Alzheimer's disease and delirium? So between these two disorders, the common difference is the level of consciousness. So whereas in the dementia, the person will not lose the consciousness, and in case of delirium, the person will lose the consciousness. And the next question, cyanotic spell is positive in which condition? So mainly in case of the congestive cardiac problem, that is a tetralogy of Fallot, the cyanotic spell commonly seen in children's. And again the psychiatric question, the 98, which antipsychotic drug cause hyperprolactemia? So the answer is risperidone. So the risperidone is one of the atypical antipsychotic most likely to induce the hyperprolactemia. So on the next question, so the best method for early diagnosis of cervical cancer, they have asked. So the option may be HPV vaccine, pap smear, health education and colonoscopy biopsy. So the correct answer is pap smear. So in that 100th question, the measurement of malnutrition is done by which assessment? So the name of the assessment is called as anthropometry assessment. So thanks for joining with me. If you remember any other question and the answers, write it in the comments box or WhatsApp to my number. And so far, if you are not subscribed my channel, don't forget to subscribe and like and share my video. Thank you. And we'll upload the remaining questions and afternoon shift questions soon. Stay connected. Thank you.